Now we have the great opportunity to hear from Professor Emiko Ochiai. She's a prominent sociologist and a professor of sociology at Kyoto University in Japan. Her areas of expertise include the welfare state and migration, capturing the simultaneous transformations in private lives and public institutions. We're very much looking forward to her keynote speech. Further ado, let's hear from Professor Emiko Ochiai.
Thank you very much for this invitation. I'm really excited to be a part of this great conference. I want to thank particularly to Professor Ungisu, the director of this center, and the hardworking staff members of this center. Thank you very much. The points I want to make in my presentation has been covered by other people in previous sessions, but please let me share my version. Can you see my slide? I hope you can. Okay, so let me start. To make my long presentation short, I want to start from the conclusion. The caring society, and the society and social science that embraces life. My conclusion is this: life before economy. Usually, ordinary social scientists consider population and labor force as a part of economy. But actually, economy is just a part of our life. It's a material aspect of our life. So it should be like the diagram on the right-hand side. So life and care are two key terms. Care is the activities to support life. And as many people say, carers who take care of vulnerable others are also vulnerable in the society where care is not valued. And in life and care are not visible and not valued in the modern societies. I said modern society, but to be precise, this tendency was strengthened in the 20th century system of social reproduction. This is the name I created. It's a combination of Keynesian welfare state, Fordist production system, and the modern family with the male breadwinner, female housewife type gender division. And in this system, human reproduction was outsourced to the family. So familiarization of care occurred. Then what was the system before the familiarization of care? I don't have much time to talk about history, but if you are interested in this part, please take a look at the books entitled Asian Families and Intimacies. Professor Un and myself are in the editorial committee of these volumes, which collected influential works written in mostly in non-English languages in Asian countries. I was responsible for the care regime part in this book project. And what we found out is that the care provision was so diverse in historical or Asian societies. I think you know the care diamond diagram. And as you see, various kind of caretakers existed in Asia in the past, including domestic health, and local government are also involved, and men are playing active roles in some societies. But familiarization occurred in the process to the modernity. So the care diamond transformed from the pre-modern type to the first modernity type. And now we are witnessing the transformation to the second modernity type. Uh, in this process, we saw defamiliarization of care by the state and by the market. And the 20th century system existed in this period, and the new system is emerging after that. And this is a famous definition, new definition of economy by Sylvia Walby. Um, uh, and the new concept of economy, she says, needs to be widened to include not only marketized activities, but also domestic labor and state welfare. This is very important. So we have to think about three-sector model of social reproduction. And if you like, you can add community or association sector as well. And as a result of defamiliarization of care, my previous researches showed the pattern like this. Defamiliarization of care service and defamiliarization of care cost are very important concepts as discussed in the previous session. And the transformation of care systems in Asia is quite amazing, particularly Korean one. Then what are we observing under the COVID-19? Sorry. This is based on my own research with Nanami Suzuki. We studied the problems and advantages of working from home under the COVID-19 pandemic. This study was conducted in April last year. As you see, many people think well, sorry, they were suffered from work-related problems and lifestyle habits, but the difference between men and women was quite impressive regarding the problems in housework and child rearing and family relations. Many women, particularly women with children, saw these areas very problematic, but not many men. But working from home also had advantages. And interestingly, family relations is also advantage, particularly for men with children. So they enjoyed life to stay with their families for a longer time. So in the working from home period, people experienced increased housework loads, but who experienced it felt their family relations are improved. Not only men, but also for women. But women also felt family relations were worsened. So people were divided. But what I want to emphasize is well, under the COVID-19 pandemic, refamiliarization of care occurred. So the defamiliarization trend was stopped or regressed. And But on the other hand, many people uh, enjoyed increased work, increased housework and child rearing time uh, because in ordinary life, Japanese people, particularly men, want, uh, didn't have much time to spend at home. So it was a kind of, uh, uh, well, opening mind uh, for them to the happiness uh, housework and child rearing produce. So housework and care are labor, but not but it's also a major part of life. This is the important thing about the nature of care. Um, COVID-19 influenced gender relations not only within the family, but also in various areas in the society. Um, and in most countries, in all the countries studied, women felt more that their lives were affected by the pandemic, and particularly in employment. This is the statistics about Japan. As you see, the decline in women's participation rate is larger than men, and recovery was later for women. And why? There are three reasons. The type of industry women are in, and the type of employment, which is non-standard in Japan, and the effect of increased housework and care burden. I can say women's role as carers uh, is behind all these three, not only three. Women are in the industries that provide caring services, and women are in non-standard employment because they have care duties. So care role is essential to think about the uh, situation of women under the pandemic. Um, Women with children uh, are uh, suffering a lot about employment too. Uh, there are the reduction in employment rate of them is larger, and recovery, there's no recovery we could see. And women in caring occupations uh, have higher risk of infection, uh, particularly women in their 20s. And um, and it's also reported that domestic violence cases increased during the pandemic period. And suicide rate also increased. It was a shock for everybody that women's suicide rate increased 83% in October last year. And they are not only unemployed women, housewives, and women living with pensions, and high school students killed themselves. And women with families killed themselves a lot. So we can see women are suffering from those elements, those factors in three sectors, including the state, the family, and the market under the pandemic. So it's unreasonable that women are suffering because of their role as carers. But what I want to emphasize is um, this shows that the employment system of this society merely functioned as expected. So this is not unexpected situation, but this is a mechanism that is built in the system of this society from the beginning, before the pandemic started. Now we know uh, well, how unfair our system is. I also want to emphasize gender issues in public services and public labor. Maybe this part is not so emphasized in other people's presentations. Yeah, people in Japan say the impact of administrative reforms was significant on, on public services. And that is the reason the public services didn't work well under the pandemic. As you see, the number of public health centers decreased since 1990s. And in Osaka, uh, many people, many patients have to be at home because the public health center is not efficient to allocate them to the hotels for those people. And well, this picture is taken from a website about the Korean system. Uh, mm, Korean government, local government are so efficient to deliver these goods to the patients and self-quarantine people from the beginning of the pandemic last year. But in Japan, still, these goods cannot be delivered in time. So, as I said, the budget cut is so severe for this sector. And the number of beds in public hospitals is decreasing. However, that is not only beds, but also workers in the public sector are affected by the budget cut. Now we can say the public services are relying on female non-standard workers. About 40% of official work carried out by local authorities is done by non-standard workers, and 75% of them are female. So now the situation is female non-standard workers are providing support for those suffered from COVID-19. So the inefficient and insufficient public services are the result of the budget cut and downsizing of the public sector. So this is a case of a women's issues counselor. She worked hard to support the women who suffered from domestic violences, but she paid no extra payment. So this 3E sector diagram cannot be complete without adding the situation of the female non-standard workers providing public services. So the conclusion, caring society. As we see, COVID-19 revealed multi-layered structure of gender issues in our social reproduction system. And not only carers, but also the supporters of carers are devalued and vulnerable in this society. So if you use the wider definition of care as activities to support life, we have to cover the situation of public sector workers who are providing social services, not only direct not only direct care works. And to build a new society, we need a gender perspective. Gender equality is an indicator that measures whether care is positioned appropriately in the society. And urgent issues we are facing are uh, the drop in female labor force participation, the dangerously low fertility, and refamiliarization of care. To overcome these issues, the reconstruction of social care and work-life balance and revision of neoliberal downsizing policies and the construction of decent public service labor is important. Thank you very much for your attention.
Thank you, Professor Emiko Ochiai, for your keynote speech. Thank you for bringing us your perspective to help us better understand what key issues are at stake and how we should look forward from here.